Okay, nerve gliding or nerve flossing is a common therapeutic intervention to help an inflamed or compressed nerve and the upper extremity. We also have them for the lower extremity as well, but today's just going to talk about the upper extremity. We got three main nerves common troublemakers. We got the ulnar nerve, which gets the pinky and outside of the ring finger. The median nerve, which does most of the palm and middle fingers, and then the radial nerve, which gets kind of on the back side of the thumb side of the hand. Okay, so to start, we're going to put some tension on the ulnar nerve. Okay, so we're going to start with our arm out in front of us, our wrist extended. We're going to bend our elbow. It's almost like we're a waiter carrying a dish, and then we're going to swing that arm out to the side, and that's where we'll start getting some tension. Okay, now those nerves come from the neck all the way out to the hand, and so depending on where you start to feel the tension is where you want to start. Okay, so once you find that point where you're starting to feel some tension and tingling maybe in the ring and pinky finger, here's where you want to bend your head towards the arm. That puts slack in the system. Okay, and the movement looks like this. Okay, back and forth 5 to 10 times, where we put slack in tension, and then we put slack and tension. Okay, and we're just reversing that. That allows us to kind of move that nerve back and forth as we go through the tissues surrounding it. Okay, now the next one is the median nerve, that middle of the palm area, commonly associated with carpal tunnel. Okay, we're going to be palm up, wrist extended, and we're going to swing that whole arm all the way out to the side. Again, once you find that tension all the way through, we want to bring the head towards to slack. Okay, and then we just work together here, bending the wrist and moving the head. Okay, 5 to 10 reps. Good. And then shake it out, and you can obviously retest, see if things got any better, maximum tension, as long as you don't feel some of that tingling, irritation, or pain into the appropriate area. Now the last one is the radial nerve. That's the one that we're going to actually go arm here, wrist down. Now we're going to bring the whole arm down and turn that hand outward as we reach behind, back and away from us. Okay. Again, we slack by putting the head towards, and then we can just create an opposite motion with the wrist and head. Okay. Flossing 5 to 10 times. Shake it out, and then reassess. Put some tension. Should feel better. Okay. If you're having some issues with some numbness, tingling in the hands, give those a try. Good luck.